production crew.
Oh,
We have it all?
This is true.
We do, because we would get
Oh,
going.
it's a notification in my...
Hello. Oh, because we know each other.
I didn't put the thing. I didn't put a label on
That's
mine.
okay. Can we label it later?
Yes.
I labeled this one.
Am I in this one? I need to scoot over here.
Yes.
You're not really in this one.
Which one?
This one. Yeah.
Hi, everybody.
Hi.
So we missed last week, so we're back now.
And we're a little late.
Just a little. What time is
late-ish.
it? Oh, it's 9:15.
That's okay. Because we can, it's fine.
Sorry. It is fine.
Because it's social media, which is
and it's
the
summer.
Nice thing is that you can watch it
later.
whenever you want to watch it, right? So that's
and
really
it's
cool.
summertime, so that also means I didn't start this.
The picture on that one is real interesting.
Yeah, it's the camera. I don't know if that's how everybody sees it.
Oh, okay. Can we
So it's
clean the lens or no?
I don't think it's that. It's the resolution.
Oh, okay. Well,
Yes.
that's okay.
I know. I'm sorry.
It's all right. Sorry if we're fuzzy.
I think that's just what we see. I don't think they see fuzzy
okay,
unless they have a fuzzy camera.
All right. Well, tonight we are going to be talking about
Gut health.
guts.
And we hear about it a lot.
We do.
But because it affects everything.
Yes.
Everything.
So, your gut
Everything.
health affects so many things, from inflammation to
Immunity. So when we can even talk
your
about
brain fog, and there's a lot of new research out there as far as your gut health and Alzheimer's and dementia, your mind,
it's a lot.
all of the things. So it is very, 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 very important. When you finish that, you're gonna have to lean in for this one, or else we need to move this one out some. We're
gonna get it.
I don't know how.
One day we'll be a better technologically.
We're good at this. Whatever.
We are.
There's 6 different devices
Let me
going
turn
right
this
now.
off.
Oh.
6, I know.
So anyway, so I'm gonna let you. So again, we'll be talking about gut health.
Yes.
I will be kind of chiming in a little bit. Dr. Crystal's going to lead this off a lot, but I will definitely be talking about my mamas and my babies and, guts and all of the things. Because a lot of times, between thrush and, yeast on the bottom, diaper rash type yeast and those types of things, we want to talk about that as well. Hey, Agapa, can you do me a favor, sweetheart? Can you please run upstairs and tell your brother and sister that they are loud and to please keep it down? That would be awesome. Thank you.
So with gut health, one of the things is it is associated with everything.
Yes.
So when we're talking about what gut health is, what it is how healthy your intestines, the inside of your body is, but mostly your intestines.
Let's start there. What are guts?
When we were trying to think
No,
of
don't
titles.
even say it.
Anyway,
No. Okay.
we're pretty creative, but we have to keep everything PG.
Yes.
So anyway,
better than PG. We have to be G. So
G.
we have to be
because
G.
we are.
So we're going to talk about. But a lot of people may not be familiar with the word guts, so we're going to talk.
Gastrointestinal, GI health.
There we go.
Intestinal health.
Yep.
And it's linked to so many different things. And one of the things, so a lot. It's such a wide. We could probably talk for several hours about it, but I'm going to try to paraphrase, and then we'll kind of see how it relates to some other conditions. It really relates to every health aspect that you can have. Montika just talked about inflammation, and anytime our body is experiencing inflammation, our gut health is going to be about immunity, and even things like allergies. Hi, Julie. Julie's waving at us.
Hey, Julie.
Even like allergies, and I'm even talking about not just food allergies, but seasonal allergies, food sensitivities, how our bodies react when we do come into viruses, bacteria, other microorganisms.
Yeah, so that's a big one too right now with the state of of the world, right? Not just our nation, and talking about being healthy. I won't go into that too much as far as my personal beliefs, as far as whatever. but
we can state facts
you
about.
can't live in fear, right? So there are viruses and bacteria and yucky things around all the time. So your best defense and your first defense is to have a healthy immune system.
And most of it is in our gastrointestinal system.
Yes, most of that is in our.
So do you know something that so you know this answer? I don't know, but what is something that we think about?
There we go.
That we think about for a healthy gut? We have to have good bugs.
Gut bugs.
Bacteria.
Right.
So if you've heard probiotics, that's something that we do. So it's very common for people to talk about probiotics, but we don't always know what they are.
Right. And then a lot of people like to throw probiotics at everything, and if you just give someone probiotics and you don't do any type of gut healing, then
it's just a part of it.
Probiotics is just a part of it. You have to have a healthy gut to be able, for those probiotics or for those bacteria, right, to be able to propagate and live and thrive like you want them to.
Yes.
Inside of your GI system.
Yes.
Yes.
So we have to have the environment. Probiotics is a part of it, and it just depends on the overall health. And when we do testing or evaluating for gut health, there's lots of different questions that I ask, or there's a lot of different things that I look at for symptoms. Sometimes we don't think there's some symptoms that we'll have that we don't think is related to that. So bloating after eating. Not having enough bowel movements, or having too soft stools or loose stools too often, pain when you go to the bathroom.
I find it so interesting that I meet so many people that think that it's normal to only have a bowel movement,
every few days.
Yes, every few days or a couple of times a week, or if they actually are stooling daily, they're like, I don't know what's wrong with me. I keep, stooling. And you should. Just like babies and puppies, you know what I mean? When you first get a dog, you feed it, and the way that you train it is you take it out to use the bathroom a couple of hours after to make sure that it can pee and poop. Things should be moving through your system. And people have, stuff sitting in their guts for years.
I've had patients tell me, that they haven't gone to the bathroom in a week, and I want to tell you, if I haven't gone to the bathroom every day, I can tell I don't feel good.
Right.
And so there's lots of other things that can be connected with that, but that's just a symptom of something that we need to dig in a little further.
Right.
Seasonal allergies, if they're always heightened,
over.
I know
because you're not in your Instagram. There you go.
If our seasonal allergies, are heightened. A lot of times, or the reaction to allergens can be heightened when our gut health is not good. So when we're talking about with gut health, we are also talking about I just categorize it. There's good bacteria and bad bacteria. So there's what they call, beneficial bacteria. There's also bacteria that's not really good or really bad, but they're there. And then there's pathologic bacteria, which can cause issues.
Right.
So those are things we look at. There are stool tests we can do to check that. There's also other testing we can do to check the integrity of your gastrointestinal lining. So whenever if you ever heard the term leaky gut. So leaky gut, so there are tight junctions in the intestinal cells that we have. And so when it's leaky, they're open, and so they let proteins, so foods that we eat, their proteins, their DNA of that food goes through, and then our body can have a reaction to it. So it's not really getting processed appropriately.
Okay.
And babies have an automatic leaky gut.
Right.
And you might know this, so if I'm saying anything out of turn.
No, I want you to say, I might know it, but that doesn't mean that the people that are listening know it. So all of those things.
And so that's one of the things too when we're introducing. So let's kind of start at the beginning with appropriate gut health and what causes. So let's say what's good gut health is having a GI lining that has integrity. So it doesn't have it's not leaky. That's developed, is functioning. Then we have these little microvilli that are on them. We want those like this and not flat. And we'll talk about some things that can cause that.
Okay.
And then we also want good bacteria to be in there and plentiful so that we can have that functioning.
Okay.
So from birth, so this is how to get a good bacteria. The mom wants to be in a particular type of health. So let's say mom is in great health, okay, and she has all the bacteria she needs. So let's
talk about great health. So number one, because one of my biggest pet peeves is that as a nation we have told moms for a long time that, you know, oh, you're pregnant and you're free. You can eat whatever you want to eat. You know what I mean? Just eat what you want to eat. You're eating for two. All of these different types of things. And those things aren't true, right? No. You are growing a human being.
This is the time you should be the healthiest.
Yes.
And actually for preconception as well.
Preconception, you need to be the healthiest. And I know that we've mentioned that even a little bit in some of our other talks as well. But ideally, you are planning for a pregnancy and preparing your body. So that means that you're getting, you know, my favorite place and I should say our favorite place, but I know we've talked about it before, is to get your nutrients from food. So making sure that you have a folate rich diet before you get pregnant is so important, or before you even start trying to get pregnant, right? Because when you're talking about just as the way an embryo is going to develop in the body, your midline, your spine, your heart, all of those things are formed.
Very important things.
Very important things within the first 4 weeks of life, right?
Before you even know you're pregnant.
We don't know we're pregnant, right? Because you don't miss a period until you're already 4 weeks in. And then you know, you go to the doctor and they're like, oh, you need to start your prenatal vitamins and you need to that ship,
it might be too late,
has sailed, right? So you want to be making sure that even if you're not supplementing, that you have a good folate rich diet, that you are, you know, if you really are planning, let's say you get married and you want to start a family, then you want to start, you know, those vitamins and those supplements, you know, prior to you even getting pregnant, and working on your own gut health. You know, those things are really, really important. One of my mentors and people that I love a lot, who's been talking about gut health probably for 20 something years, is Jennifer Tao. And she always says, you know, heal the mother, heal the baby. And if that mom is having gut health issues, you're passing those things on to your infant, you know, and those things, that's a big deal. So we want to heal our guts as women, you know, as anyone, women and men, of course. Yeah.
Yes, but it gives our babies a better chance.
Yes.
And then from birth, so let's say we do
I digressed.
No, that's good, because and this is why it's hard talking about gut health, because there's so many things that tie into it. Yes. And it's like, where do you start, right?
I know we'd be here all night, but we're gonna still. So we were at microvilli and
yes, and then
babies and
mamas. And where we start is, so if the mom is, and we'll just start here. If the mom, let's say everything is good, right?
Okay.
So then we have a baby that's growing, everything's well. So then we're gonna talk about the birth process. So when a baby is born through the vaginal canal,
right,
the vagina,
yes,
then there's lots of bacteria that are in the vagina,
maybe
that the baby will ingest. I know it sounds gross,
unless you are group B. And
yes.
Then if we dump you full of antibiotics, we don't only kill the good bacteria, but the bad bacteria. Yes. We also kill the good bacteria.
Did you know? So grapefruit seed extract. So my midwife, when I was pregnant, told me that before we checked for group B strep, she would have her moms take grapefruit seed extract. It's a little extract. You take so much because it is a natural antibiotic or antimicrobial. And she said all of the moms that took it regularly would never test positive for group B strep, so then they wouldn't have to take the antibiotics. Because once you test positive, they're going to want you on antibiotics to be able to because we don't want you to have group B strep while you and the baby born. That can be detrimental to the baby.
Right.
So there's some definitely some things. So if you take an antibiotic, it kills good and bad bacteria. So we don't want to do that. So we're going to do grapefruit seed extract. But let's say we don't have group B strep. Everything is good.
Everything is good. No antibiotics. So what we're talking about is a perfect world, right? So in a perfect world, if you were, everything was good, your gut health was good, you carried your baby to term, right? Because also if you're preterm, a lot of times, all of the things. So we're not going to go into all of the what
yes.
of the what.
We're going to say this is how we start off with a healthy gut, and then we have a vaginal birth. Now, this is not to say if you don't have a vaginal birth or you weren't born, if you're born cesarean, then that you don't have a chance. We're just saying we want the best chance. So the bacteria that's in the vaginal canal of a healthy woman is going to inoculate the baby with good bacteria. That's going to be their first exposure.
Right.
To bacteria.
Well, all of the bacteria in the perineal area as well.
Yes.
So you're going to have, I know, again, we keep it real around here, but when you are pushing a baby out, everything tends to come out with that baby. So a little bit, of fecal matter, even though the doctor is going to, or the midwife will wipe that stuff away, that baby is still, exposed to that. So everything that's in your gut, that's why, when you're talking about setting up that baby's immune system and all of those things, that's what is happening when they come.
And this is interesting, and I don't know if they do it here. You may know this better. So very recently, since they've really come to light about this, and so of course people are like, "Oh my gosh!" But
if seeding,
yes.
Okay.
So if a baby is born cesarean, what they'll do is they will take the bacteria from the mother's. Yeah, so they'll do that here, but you have to ask.
You have to ask, and then.
But let's tell them what that is.
Oh,
you take it from
you can tell them.
So you take the microflora from the mother's, which is bacteria.
Nice.
Yeah, microflora. It sounds pretty like flowers.
Yes, it sounds better than poop.
Yes, but it's not just poop; it's from the vagina too.
Oh, okay. Yeah,
so it's not just fecal; they just take it from.
Yeah.
They do that with C. diff, though. That's really interesting.
Yes.
So
speaking of guts, which is oh my god,
that's another horrible thing.
If you've ever smelled C. diff, it is.
But they do fecal transplants. Look it up. It's not what you think. They do fecal transplants and help cure C. diff, which is really because it's Clostridium difficile,
right? And
which
C.
is
diff
a bad bacteria.
Is a very bad bacteria, and a lot of people that are in the hospital for long amounts of time
it's hard for them to fight
end up with C. diff because it is usually a hospital acquired.
Well, it's in the same family as botulism, and it has spores, and it's hard to kill, and all that good stuff.
And we have
I taught
a lot
microbiology.
You did. We have a lot of antibiotics going on in the hospital, so a lot of times our older folks will end up with C. diff, and it's just a very, very interesting smelling type.
It's horrible.
It's pretty bad.
So they can seed, or they can take the vaginal bacteria, vaginal microflora, and the flora, and they will inoculate the baby orally. So they'll give it to the baby orally to be able, because that's how the baby would have gotten it if it was birthed through the vagina,
right?
To be able to inoculate their system, and then after that, they're going to get probiotics from the mother's milk.
And it's not necessarily, it may sound deep,
gross,
but it's really, when you're talking about, it's not like they're eating anything per se, right? But it's all over their face because you're in your hands, and they put their hands in their mouth, and they're licking and touching and all the different types of things. So the exposure is there. So what you're doing in seeding is creating that exposure that would not normally happen because the cesarean section is going to happen in a sterile environment. So you're not really giving that baby the opportunity to have its gut naturally seeded by coming through the birth canal. So kind of going back to what we were saying, if you have that vaginal birth, you haven't had antibiotics, now we've seeded that baby, now we're moving on to breastfeeding, right? Breastfeeding is also going to further build that baby's gut microbiome.
Not just from inoculating it with probiotics from the environment, but also from the nutrients, the immunoglobulins, all of those things that the mother's milk. And to be honest, and this is not to shame anybody who doesn't, we just want to give facts out here. Formula does not even come close to what breast milk offers. And so if you are in a position to ever have to choose between breastfeeding or formula, do your research and make a decision that you think is best for you and the baby.
Right. But I mean, that's even with, I was a NICU nurse for a long time, and when you're talking about, the micropreemies and these little babies who are immunocompromised and that are, very delicate, at least at Hillcrest, Maine, we have donor milk from the Mother's Milk Bank in Oklahoma City, right? And so that milk is sterilized, and
So there's lots
they
of
go through all the
options
things
now.
and tests and everything, but those babies in the NICU do so much better with that breast milk versus formula, because the formula was so hard on their guts.
It's very hard on their guts because it's made from corn or soy or these things that again, when we talked about, so we're going to go further after you explain about leaky gut.
I was just going to talk about neck, because neck is basically when the intestine dies from, and so we wouldn't see.
So neck is the abbreviated term.
Yeah, and it's a long word that
it means part of
yes. that I am not.
It means
getting ready
that
to
it's
try
dying.
And say right now.
It
Right.
means that it's
so that when that gut tissue dies, then that baby is you're losing a baby a lot of times. And so what we want to do, or what we do in the NICU with those micropreemies, is if we give them that that donor breast milk or from the milk bank, and these babies, we saw the numbers in neck go down tremendously, from not giving those babies that. So, it fascinates me that we understand that about the smallest babies, but we don't transfer that on into the older babies, right? Or into, adults or whatever. Just because you don't see the immediate results of something right then does not mean that it's not hard, on your body, or that your body is not having a difficult time, dealing with those things. When we're talking about, like Dr. Crystal was saying, allergies, eczema, colic, all the way up to not pooping, and GERD and irritable bowel and whatever else that's maybe causing you to like pop Tums, or Alka-Seltzer all the time, or Pepto-Bismol, for a long time before the commercials became just all pharmaceutical commercials. I remember when I was younger, there would be a ton of like just Tums and Alka-Seltzer commercials where like, hey, did that chili dog with extra hot blah 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 and make you that you ate in 5 minutes while trying to get back to work, did that upset your stomach?
Your gallbladder wasn't ready for it.
And it's like, take this Tums, take this,
so we're putting Band-Aids over, but
Band-Aids
actually what we're finding is that PPIs, which are proton pump inhibitors like Zantac and Pepcid, actually change the gut flora.
Right.
So change
and deplete the nutrients in the gut that you need to be able to digest.
Yes. So we're causing more issues.
Right. And then you're also masking symptoms, right? So then you may not feel what's going on in your gut anymore, but it doesn't mean that it's not.
Yeah, my elbow hurts.
I'm sorry. It doesn't mean that it's not completely, tearing your gut up. So those are things that, again, your body is smart, and a lot of times pain is there as a warning thing to tell you, hey, I don't like that. Can you not do that? And it might not necessarily just be the chili dog. It might be how fast you're eating that chili dog, right? Because when
you're going to talk about air, and you're going to talk
I'm not. I was just going to talk about rest and digest and sitting down and chewing your food, actually.
And then processed
and not
foods
inhaling it. Yeah.
And high processed
all of those
fats.
things. So, like, we could break this talk into, like, a whole series of things.
I kind of would like, I know we talk like, it would be nice to at least to maybe even like a group where people could, where you're interacting, if we have questions, and we can go back and forth and like have a dialogue too sometimes. But at some point.
Okay, so back up.
Yes, so we have the baby, and so I'm going to start naming some things that can start causing issues and with the gut lining and gut health overall. Okay. So first things we talked about is the mom not being, being in great health, and we talked about what that means to some extent. Right. And then we talked about what type of birth the baby had. Mm-hmm. Then as the baby is growing, what kind of food it's getting initially. So the other thing that I don't know, like you deal with babies a lot more than I do, but is how old the baby should be when we introduce foods and what kind of foods should we be introducing. So here's a couple of things that I hear, and you can kind of elaborate on some of them, or that I know, and I know these are very common. The baby is spitting up or seems hungry all of the time. Oh, just put rice in the formula or rice in the breast milk and mix it and give the baby. Oh, you can feed the baby. You can start as early as 2 months to feed the baby whatever and start food, whatever they want. You can feed a table food, the same things you're eating when they're ready.
These are all the things you don't want to do.
You don't want to do.
I just want to throw that out there. Okay.
So here's what I do know, and you can elaborate on these. So what I do know is, if it was me, and I did this with Jade, you don't give rice at all. You don't need to give rice to settle down. If you're having acid reflux or GERD or whatever issues, or spitting up all the time, we need to figure out why. Now, when somebody brings in a baby to me, for that, because I can check them and do adjustments and take care of them that way and do some body work, and Avantika does body work and does other assessments. I look at what is the baby eating, what kind of birth the baby had, and then the other thing to look at is how old the baby is, but not just how old is the baby able to sit up on its own, because when the baby is able to sit up, it is directly correlated with how developed the gastrointestinal system is, to let you know the baby is ready for different types of food.
What age is that usually?
6 to 8 months, and Jade was. Yes, because people think 4 months. Oh, the pediatrician told me I could feed the baby, and I'm sorry if you're a pediatrician and you've told somebody this, but this is not true. Because the American Pediatric Association puts this literature out in a peer-reviewed journal article. So if your pediatrician, I'm going to step on some toes, is telling you something different, it is inaccurate.
Okay. So I just wanted to chime in with the 6 to 8 months and talk about a little bit about development, right? Because at around 6 to 8, well, I'll say 6 months. At around 6 months, when they're sitting up on their own, right? If they're not sitting up on their own, and of course, all babies have a little bit different timeline. So if your baby's not sitting up, it's okay. It's just not. So when it is, then that's when it's going to do it. But they also start working on. They start developing their pincher grasp, right, when you're talking developmentally about a baby. Then they're also working on that hand-eye coordination. So they're able to pick something up and they're able to put it in their mouth. They also are not tongue thrusting anymore, right? And so when you're tongue thrusting, you're not ready to eat food because you're just going to push it out. Right? And so when you see these videos, it's amazing to me. Like, you watch all of these old movies or even movies now. I think I was watching Jack. What is it? Incredibles. Thank you, Agape. So they're like feeding Jack, and she's doing the spoon and she puts it in his mouth and then she wipes it and they put it back in, and then you wipe and you put it back in, because they're steady pushing it out. That means that they're not ready. If they're still tongue thrusting, they're not ready to be eating solid foods. That reflex that will stop. So when they are sitting up and they're putting food in their mouth, they're no longer tongue thrusting. They are ready to start eating things. So we want to feed them things that are, soft, that they can pick up, put in their mouths, and that they can actually start eating. And from a oral development standpoint, you really want to start them with things, because we want to build good, strong, healthy jaws, right? So I really like baby-led weaning, because when you're doing it that way, as far as breastfeeding, right? We're talking about breastfeeding. But even if you're formula feeding, right, and you're given a bottle and it's formula, you still don't need to be feeding that baby solid foods. And
the reason why, so some of the things, of course, is safety. But then some people are like, well, I did it, my parents did it, I'm fine. But here's what it does is, so when we talked about that, fine is relative. And understanding and education is empowering. And so it doesn't mean what you did, well, you're wrong and you shouldn't do that. What we're saying is, let's arm ourselves with education and facts, and then we can make more informed, more empowering decisions.
Yes, because your parents did the best that they could do.
So there's no shame.
And I did the best that I could do with Agape 12, 14 years ago. You know what I mean? How old are you? 14 years ago. And so you have to, and when you know better, you do better.
You do better,
right?
yes.
And so that's the thing. We're all learning.
So this
what
is
to
just
do.
another way to learn.
Right.
And I will tell
because
you,
I think I was breastfed for like 2 weeks, and my mama was over it.
Well, and I'll tell you, and you know, we look to our healthcare providers to give us the most up-to-date and accurate information, and unfortunately, a lot of times they're the ones that are giving the inaccurate information. So,
Right.
whenever I give advice, I'm basing it off of the most up-to-date, and if I'm not, I need to review that and look. But if you give a baby a food before it's ready, and so when they're not sitting up and they're not doing the things that Montika was talking about, they're doing, and they're not ready, their gut is still leaky. And so when you eat food, it's made up of proteins and amino acids, and so those proteins will go through, and they don't always, they can cause an immune response that the body will give, because it's not, those proteins will go where they're not supposed to be,
Right.
and that can allow babies to develop food allergies.
Sensitivities usually first.
Usually sensitivities.
And they can develop into, which is interesting though, because when you're talking about leaky guts and formulas and different things like that, some of the major players as far as allergens in people are things that formula are made out of. You know what I mean? When you're talking about the soy, the dairy, and the corn, right? All formula is gluten free. So a lot of times doctors will say, well, babies are allergic to your breast milk, take them off of your breast milk, put them on formula. If that baby has any type of gluten intolerance, so if that mom has gluten intolerance, that baby most likely has gluten intolerance. So as soon as you put that baby on formula and they're doing better, most likely that baby has some sort of, gluten intolerance as well, which is why you'll see, that improvement, because so many people are sensitive to gluten, which swings back to inflammatory and everything else.
But it's that gut health, that initial gut health that we're talking about. And so a lot of times this will happen, and then we have these symptoms that come out, and then we'll say, oh, the baby is allergic or has food sensitivities. And that can play a role down the line, Miles. That can play a role down the...
Agape, can you come get Miles, please?
Down the line that...
no, come get him, please. Thank you.
It's like he knows what we're doing.
Yeah, he wants some attention.
Down the line, that can cause issues. Oh my goodness.
Get down, boy. You might have to put him in his house, Gups.
And so that's another thing. But this is what I was going to say. This is so cool. So one of the things that breast milk has, and I'm just going to be very general here, is immunoglobulins.
Right.
So whatever the mother's eating typically, I mean, there's some.
Oh, I forgot I was live.
You are live.
Yeah.
There is some.
That was a.
There is some times when the baby will be allergic to what the mother is eating in the breast milk, right?
Good job.
But the breast milk has immunoglobulins in it that are very, very healthy. And what those immunoglobulins, one of the things that they do, is the immunoglobulins do is they help whatever the mother's eating they help the baby absorb, digest, all of those things. So there's a product that I use, and adults, the IG-26. That's immunoglobulin. So when I say that,
I love it.
It is great stuff.
It has been amazing for my own good
It's
gut health.
one of my I have a basic thing that I tell people to do for gut health when they come in before we do a full evaluation. A probiotic and an immunoglobulin that I have is great.
Say that word again.
Immunoglobulin.
Oh, that was good. It was funnier when you said it the first
time because I didn't quite say it right. And so it's like so that's what it helps. And there's something, a side note, so a lot of our digestion, so if we do a basic nutrition biology class, we know that there's enzymes in our saliva, there's enzymes, there are different ones that break down carbohydrates, there's enzymes that break down fat, there's enzymes that break down protein, and they're different places. But a lot of the absorption, so a lot of the breakdown and absorption will occur before we even get to the lining, and absorption in the small intestine. So if there's an issue with absorption, which there's the immunoglobulin supplement can help quite a bit. Colostrum is something else that you can take. They'll have different things. So there's so many different things that we've used.
And colostrum is something that babies get when they are breastfed within
Yes.
the first 2 weeks from their mama.
Yes.
So it is so
gut supportive.
important to breastfeed. I
Yes.
think that is like, y'all know that I obsess about breastfeeding, and we're all about women's health and so on and so forth. But that colostrum, I don't care if you can only breastfeed for a couple of days. You know what I mean? Whatever, any amount of breast milk for your baby is going to be helpful. Mm-hmm. So I just really, really encourage everyone to, if you are pregnant and you're having a baby, to try. You know what I mean? And if your baby ends up having to go to the NICU for whatever reason, hand express and get that colostrum out of there so that you can give it to the NICU team and they will give it to your baby.
And we're more supportive in those environments now in the last several years than we had been previously to try to encourage moms.
We do, but we also have a lot of folks that are in rural areas, you know what I mean? And so, we're not always talking about, our main hospitals,
Correct.
here. And so if you are in an area that's a rural area, you may not have access. They may not have, the symphony pumps and all of the fancy stuff, and hand expression is a tool that is extremely helpful. That's
using your hands to express breast.
Oh yeah, I'm sorry.
Milk.
That's using your hands to express breast milk.
And that's something we're going to talk about, because even though we keep going off on tangents back and forth because there's so much
it's
connected
not a tangent,
to this.
it's all connected.
But what I want to say is one of the things we're going to talk about, because when we're talking about vaginal canal and inoculation of that bacteria and hand expression, I know a lot of people are like, no, I can't touch myself. Oh no, I don't want to know what. I don't want to look at my vagina, all those different things. So we are going to talk about acceptance, and when we know what things are and what they are, and that it should be normal to say vagina, like elbow, like it's a part of our body.
Right.
Or hand expression. There's nothing negatively sexual about it. It's just, you know what I'm saying?
No, you need to know the parts
these things
of your body so that you can take care of yourself.
So we're going to do a talk about that at some point to be a little more desensitized in an appropriate way to our bodies.
Right.
Women have a harder time with this than men, and this is a side note. We have a harder time than men about this, but anyway.
Right, but hand expression, there's some great videos out there, and if there's any moms that are my mamas or in the future or that are curious, I will, send you videos. I will help you learn how to hand express. Because I know I've seen so many women that don't respond well to the pump, and man, if you can, it takes practice, but hand expression, a lot of people in different countries, people in rural areas,
they do.
That's what they do. That's what we've done for centuries. Mary didn't have a pump. These people didn't have pumps, but they breastfed. You know what I mean? And so you have to be able, to get milk out, and it is.
But that's all they had. And so they
skill.
also wet nurse too quite a bit. We can talk about that another time.
Yeah, we can talk about that too. Okay, so wait, where were we?
So we're feeding babies.
We're feeding babies.
So and then as we get older, antibiotics.
Well, yeah, because even as you get older, like so many of these babies
are on antibiotics for all these things. And so this is what's interesting. I read a paper that talks about when you're on antibiotic therapy, it can take up to 2 years for your gut to go back to normal.
Right.
And that's 2 years is going to be if you're not doing anything about it to be balanced back out. But there's definitely things we can do.
Ooh, I want to throw one other one out there. Speaking of, stepping on toes, and we're not saying that you shouldn't or you should, but you should know that vaccines also
can
affect your gut flora.
Not all of them have been shown to do that. The MMR in particular has been shown to do that.
Just wanted to throw that out there. Yeah. So if you are, vaccinating, then you want to do some gut healing, around after that those vaccines have been given to your baby.
I don't want to mention this, and I will mention it later because I don't want people to get the wrong impression. Okay. So, but yes, so there's definitely different, and medications,
and even as adults, things. Right? Because we get back. I mean, we're nurses, so in the hospital,
we don't get MMR unless you haven't been.
Well, yeah, but still,
it's things to look at and look at different. Yes. informed. And that's what we want you to do, is make informed decisions.
Informed decisions.
No matter what you choose. And let's see. So those are all the things that can, and then some things like gut infections. You can get sick and have like SIBO. So SIBO is another gut disease. It's called small intestine. Oh my gosh, I can't think.
I don't know. I don't know what it is. Just stick
bowel,
with SIBO.
Small intestine bowel overgrowth.
Oh, okay.
It's an overgrowth of pathological bacteria.
Okay, I'm sorry.
Pathological bacteria that can make you sick for a long time. I've had patients come in and be very, very sick from this for a long time, and thought they were healthy, otherwise have been sick, and it is very difficult to overcome. And so this is when we do a little bit more intensive gut stuff. And so I don't want to say I'm an expert at it, but I'm very confident that when people have this, if they follow my advice, and they do very well. They do very, very well with it.
Yeah. And I feel like these are all things that can be taken care of, right? Because I see a ton of mamas that have babies that are colicky, and I have really good success with the babies that I see, as far as helping them to be more comfortable,
Yes.
Things aren't always, perfect, but definitely helping them to feel better. And I definitely have had many that were colicky that are not colicky anymore.
Yes.
So there's all kinds of things that are going to play a part in that. Dr. Crystal mentioned airway earlier. The way that you make a food bolus is also very important, right?
So that she's saying how you eat.
How you eat, because digestion starts in your mouth, right? So if you're not able to chew your food properly, because that's masticating, that mechanical part of it helps to start the breakdown process. The saliva in your mouth
is the chemical
helps to start that breakdown process. So if this isn't working the way that it needs to, then it's gonna put extra strain on your gut. So a lot of times your gut will produce more acid, to compensate for the fact that you're not chewing the way that you need to, or there's a lot of people that have dry mouth and all kinds of things.
So a lot of things too, for when people think they need like Tums or Pepcid or Zantac, is they think, I have too much acid, and a lot of times actually you don't have enough, but then during those times you eat, you overcompensate, and then you have heartburn. And then heartburn over a period of time is the GERD, which is the more of the disease. Gastroesophageal reflux disease.
Yes.
I always say these things in my head when I say them to make sure I
So I feel like this is definitely helpful to say all of it, but many of us live in acronyms, so it's
that's why when you hear it, you know what it really means.
Right. So when you're talking about what she was saying as far as your GI system, that is exactly when you're talking about GERD. That's what we're talking about. Your gastrointestinal system is not working properly, and so that acid is literally coming up into the esophagus where it's not supposed to be, and it is, it burns, it hurts, and those different types of things, and can be really, really uncomfortable. So we went from babies to toddlers, and let's talk about some adolescent stuff as well, if you want.
And so I think all of that's after the toddlers get into, where they're eating a lot of the foods that we're eating, and they are being treated, even though maybe to different degrees, but for the same types of conditions, unfortunately, or with the same types of medications and exposed to the same things. The things that assault our gut is going to be the same. So in general, the things that can cause an issue with gut health is from the very beginnings of life, what we just talked about. The other things are going to be, what kind of foods am I eating? Highly processed foods that, all of those types of things.
Well, that's why I was talking about adolescence, right? Because a lot of times we don't want to, our teenagers want to eat whatever they want to eat, but still you are in the process of growing, right? And so this body you're going to have to live with for the rest of your life. And we want to be able to live, a long and healthy, comfortable, prosperous life, right? We don't want to be uncomfortable and miserable. So really continuing to, as parents, continuing to encourage not only by breastfeeding, but by making sure that our toddlers, are eating what they need to be eating, right? So another thing that I talk to a lot of my moms about is the standard American diet and what we want to feed our toddlers. Because when you go to a restaurant or any type of kids meal, what you see is chicken nuggets, pizza, hamburger, and hot dogs, most of the, and some sort of pasta, right? So yes, those things are highly processed, but those are also things that you don't have to chew, right? So I'm all about oral health, airway, gut health. Those are going to be, like, to me, those are foundational things that have got to be looked at when you're talking about your health.
And eating foods that have good bacteria in them, too.
And eating foods that have good bacteria in them, which processed foods do not. But when you're feeding these toddlers these foods that they don't have to chew, right, you're not giving, if they're meat eaters, right, if you're giving them pureed meat, you're not chewing that, right? You're sucking things through. Now we have the pouches that babies are sucking things through. We're giving them purees. We're giving them hot dogs and cheese. So a hot dog is what? Pureed meat shellacked into a shape. A hamburger is ground up meat shellacked into a shape. A chicken nugget is ground up
sometimes
pureed
it's
meat.
Ground up pureed.
Usually, right?
Could be something else, depending on where you get it.
Yeah, well, that's true. But, most children aren't eating like the chicken fingers where, like, it's going to be the peeled, like an actual breast piece. It's going to be minced up meat. And then it's interesting because then when they get a little older, they don't like textures. Well, they never had a texture because everything that they ate was like
mush.
Basically already chewed up for them, which is gross. But that is really, when you look at it, that's really what it is.
Remember that a while back when that was the thing, when moms were chewing up the food for their kids and giving it to them? It was like a thing.
I don't know. I don't feel like that's the most horriblest thing. I don't know. To me, that would depend, right? Like if you were feeding a kid and you were eating steak and you were like out. I don't know. I just wouldn't.
Okay.
I don't know.
It was an interesting
thing. What? Okay.
Okay.
So feed your kids. They need to chew.
So then as we get so we see some of the things that can affect our gut health and then to keep them, we know that diet, and we can go into at some point, what is some of the best things in a diet. Taking a good probiotic supplement can be helpful. But some of the things that I want to say that
because what about probiotic rich foods too? Because you mentioned that when you're eating processed foods, you're not getting those good nutrients. You're not getting those foods that have, people talk about prebiotics, right? Yeah. So your gut, even if you're taking probiotics, you still need to have good healthy foods in there for those probiotics to even be able to feed on and live, right? So
there's certain things that the bacteria do need.
Mm-hmm,
right. But some of the things that a lot of times when we talk about getting probiotics in our diet, we automatically think of yogurt. And so the negative that I have with yogurt, so not everybody's going to have an issue with dairy, but a lot of times I don't like to start there because a lot of people do have sensitivities to dairy. And then for me, I go all the way there. If you guys know me, I'm like, it's not always an easy answer. So I say, well, if you're going to do dairy, it needs to be whole, full fat milk. Right. And it needs to be grass-fed and organic. And then they're
grass-fed and grass-finished, right?
And grass-finished. Yeah. And then so they're looking at me like, so you want me to get yogurt, and it can't have any sugar in it. Mm-hmm. It has to be from a cow that's eating grass the whole time, and it has to be organic. Mm-hmm. And you want me to do full fat milk? Like, it's all of these things that it's the opposite of what we're normally told.
Right.
So, but a lot of times too, even if you do that, if you do have an issue with the dairy protein, then you're going to have a reaction to it. And then if you're eating a lot of these, if you don't have a healthy gut, whatever you are eating will show up on a food sensitivity test.
Yes.
That you are sensitive to because it's getting you have that leaky gut.
Right, and it'll show up on a baby sensitivity test.
Yes, so
as
sometimes
well.
those can be very helpful, and sometimes they're not helpful. It just depends on the situation, and they're expensive tests. I have to recheck, but a lot of times they can range from $350 to $550 for a food sensitivity test. And the reason why I don't always like to use them because of the price is because they change. They change depending on what kind of health your gut is in, but we can talk about that's something we can talk about.
Right. And I mean, even with that, I think that they're great, but I've seen babies that have had, moms have done, not older babies normally, but they have done those sensitivity tests on them, and they've shown sensitive for all of these things, and then mom goes and takes all of those things out of their diet. But if you haven't addressed the fact and healed the gut of that baby,
they're gonna be
all of the new things that mom starts eating, you'll see that baby's gut improve for or those symptoms, I should say, improve for a little bit, and then all of a sudden those symptoms come back, and then you run another test, and now they're sensitive for all of the new things that mom is eating, because you never healed the gut and you didn't address the problem. But the good thing about that
is the good thing about that test that does tell you is that it's really truly a foundational gut issue.
Yeah. Yes.
So because we're running like it's almost an hour.
That's true.
Yes, but so I like to think when people ask me, and I'm just a side note with testing, when they ask me, is it worth it to get this test? Is it worth it to get this test? I always say it depends, because you can always get some kind of information. Nothing is ever really wasted. Right. And so in that case, it's like, well, I just wasted this money because it's showing me this, but it's like, well, now you're pretty much confirmed that you have a gut issue. It's indirect, but you can deduce that from that information.
Right.
So here's some things I kind of want after we do all of this, things that can, and I'm going to say most of us don't have have a gut has all of it that's fully healthy, that we all need to work on it for multiple things. However, gut health can be associated with what we think is gut health diseases. So we talked about pooping like appropriately, or having healthy bowel movements, but the other things, Crohn's disease, ulcerative colitis, irritable bowel, those are all bowel issues. Celiac is an autoimmune that is a bowel issue. GERD or reflux, that's going to be something. Other autoimmune diseases, every single person that comes in to me that has pain all over, that has autoimmune disease, I always look at the gut first. When they have issues, the gut health is one of the main things I always look at, because if you have if they have a high inflammatory markers, they have high autoimmune markers. I have a patient that had high autoimmune markers. She was diagnosed with mixed connective tissue disease because they couldn't isolate it to a particular autoimmune disease. She started healing her gut, changed her diet, all of this stuff. Do you know those markers went away? Now, it doesn't mean that you are cured. We can't say cured, but your body is operating at that point like it doesn't have the autoimmune disease.
Nice.
But if you get to the point, so celiacs with the microvilli, the gut is damaged, so we have these microvilli. So the reason why, and I'm showing my hands because they look like these little bitty fingers.
Your nails are cute.
Thank you. But every side of that is a place that I can absorb nutrients.
Okay.
So in celiacs, over time, the microvilli get flattened out, and so then you have less surface area for the gut to absorb, and that's why not all of your things are getting absorbed. Diarrhea is a problem. They're not absorbing their nutrients. So when they do a scope down into the small intestine, that's what they're looking for. That is the definitive test, which is a little bit invasive, but a definitive test for celiacs, more so a lot of times than markers, because markers can lie to us. They can be reacting to something else or showing us something else. It's very hard sometimes. You can't make a diagnosis. You can't have a celiac marker say you have celiac disease. You have to have the markers. You have to have other things clinically to match up to it.
I think it's like that with a lot of different diseases.
It
I
is.
know with lupus you have to have like 10 out of however many markers or
so if you have an autoimmune disease, number one on the list, gut health. Number one. Medicines, all this stuff, whatever. If you have seasonal allergies or allergies all the time, post-nasal drip, gut health. I would always go there first. If you have, and then, of course, those are things I want people to know tied. This is what I wanted to say earlier. It's a little interesting. So I didn't want to tie autism to vaccination. That's a discussion for way another time. But I wanted to tie autism and obesity and all of these things to gut flora. So you know that they can take the feces of an autistic child and a non-autistic child, and they can tell you which one's autistic. They can take the feces of someone obese, has certain type of bacteria in it compared to someone who's not. So our gut health and our bacteria that's in our gut play a huge role. Now, it doesn't mean that it's correlated. It doesn't mean one causes the other. We don't know that yet.
Right.
But we're saying it's correlated.
Yeah. I like it.
Yes.
So what can we do since we've talked about all of this different autoimmune stuff? What are some different things that you like to do? For me, I always start with, with foods, as far as, gut healing and different things like that. I know some people do like bone broths and things like that. I will say, again, just like Dr. Crystal was saying, if you're going to do a bone broth, right, you want to get it from a grass-fed, organic animal, right? Yes. So because you are getting all of that animal, when you're talking about, the bones and the marrow and the things that are in there, we want to make sure that you aren't getting a lot of pesticides and in concentrated amounts, when
Correct. Because when you take those things, it is concentrated.
Hey, y'all gotta go.
Because it is concentrated when you do that.
Right. So bone broth,
the collagen and the bone broth,
yes,
all of that is wonderful.
Wonderful. And then there's also some good organic gut healing broths that you can not just organic. Purchase. That's not what I meant to say. Nope. For my vegetarian and vegan friends, there's some plant-based or plant-only plants that you can make a gut healing broth with that as well. Some good recipes for that too. Ferments. How you feel about ferments?
I do like fermented.
Okay.
So like sauerkraut, and so this is the one thing I like. So a lot of our commercially produced, like, so I'll just get sauerkraut. Not all sauerkraut is really fermented.
Most sauerkraut is not fermented.
Yes.
Most sauerkraut is sitting on a shelf in the center of the grocery store. And there's nothing alive in that. It's sitting in vinegar.
So live foods, yes.
Yes, it's sitting in vinegar. So most of your pickles.
And it's been pasteurized to the point where the bacteria are killed.
Yes, and so I've always found that interesting too. When you're talking about, again, circling back to moms, because y'all know moms are my thing. But when we're talking about cravings and things like that, moms they would say, oh, well, she's craving, pickles and watermelon and different things like that. A lot of times, we don't drink enough water, so then we're thirsty, so we want those foods that have a lot of water in them, right? And then the other thing, when you're talking about the way that pickles and sauerkraut used to be made, they were fermented, right? And so we have gotten away from that. So if you like pickles, if you like sauerkraut, if you like these different types of things, kimchi is another one. Miso is another one.
I was about to say miso.
Those types of things. Go to the refrigerated section. Find one that actually says that it's got fermented. That it's fermented. That it's got. Most of them will say they have live bacteria in them, or probiotic rich, or some sort of verbiage. Like that. And because those foods are gonna be good for you as well. Mm-hmm. What else? What other foods do you think? Or
so a lot of times
supplements after that?
I would. So I talk about putting good foods in, but I also talk about eliminating foods that could be causing damage. And so before we do like a test, I look at, here's the common offenders: dairy,
right,
gluten, corn, eggs.
Okay.
And soy, but people don't eat a lot of so
you
a lot of these
eggs more than soy.
Yes. But it's because these things are in a lot of processed foods.
Yeah, and
so we're eating
I bet
the
it's
proteins
also
of
the
those
way that those animals are processed as well, because a lot of chickens get.
Does this cut us off?
Yes, I think it only gives us an hour, so we need to hurry up.
Okay, so that's the other thing, and then when I moved to some basic. So the nutrition, and then those supplements, the two things I always start out with is a good probiotic and the immunoglobulin, depending on what's going on. Mm-hmm. And then I like to talk and evaluate more before I go beyond that. Okay. But those are some really easy things to do. The immunoglobulin might be harder to find. So then we talk about doing a good probiotic. Maybe we'll do one just on probiotics.
Contact us. We
can. It's hard to find outside of at the store.
Yeah.
But we carry some really great products, and we only carry certain types. But the other thing is a good probiotic, and we can maybe do one on just probiotics and what to look for in a probiotic, because that's something else.
That's a whole nother
conversation. The different strains, the different combinations. I like to keep things simple, but at the same time, I have to understand why I'm giving something. I can't just say, oh, just go do that. I don't typically do that. So I like to.
So we could talk about gut health all night, and we may actually come back to this and maybe break gut into some different categories. But
we want to talk about inflammation, autoimmune too another time.
Yeah, we can do that too. So we will see you guys next Friday.
Yes.
Everybody, happy 4th of July, Independence Day. No, okay, don't look at me like so. Yeah, Lord,
you already know what I'm saying. Nothing.
Okay, so pop some fireworks, eat some barbecue.
Don't go running and fall on the sidewalk and scrape yourself up.
Yes. We're gonna sign off. You guys have a great share, and we will see you guys next week.
Friday.
And if you have any questions, or any topics that you would like me and Dr. Crystal to speak on, please just drop it in the comments.